Hi, everyone, and welcome to episode 127 of the Veterinary Behaviour Chat podcast. And today we have another one of our super fun speed coaching episodes where I get to chat to professionals in the field for 15 minutes about a topic or a question of their choice. And today I have Dr. Julie Liu joining me, who is a veterinarian who practices in the US, but I'm going to let her introduce herself in a lot more depth and detail. So welcome, Dr. Julie. Lovely to have you with us today.
Thank you so much. So, just a little bit about me. So I'm a cat-friendly and fear-free vet based in
Yay.
Austin, Texas in the US, and definitely a cat person. I
Mhm.
have a lot of different roles in vet med. So I'm a speaker. I do feline-friendly consulting for vet teams and businesses who want to move in a more cat-friendly direction. And relevant to this podcast, a couple of years ago, I launched my cat behavior house called Practice My Family Cat, where I help caregivers in the Austin area with concerns like intercat conflict, elimination outside the litter box, anxiety, fear of the vet, issues like that.
That is so amazing. And a career that speaks very closely to my heart because we're also a cat-friendly clinic at the German Veterinary Clinic, and we've practiced cat-friendly practices for many, many years. And I too see a lot of feline cases, as I think you probably also are aware of, and which is quite different, though, to a lot of behaviorists, a lot of my veterinary behavior colleagues, that definitely they would probably have more of a canine bias. So it's so great to speak to a fellow feline professional. I see a lot of feline cases, so I'm really excited to chat about the specific question that you have. So let me go over the rules of the game, and that is we are going to do a pretty much unscripted, off the cuff kind of episode. And the big thing is we are going to restrict it to 15 minutes only. So I'm going to set my timer, and I always say this in every episode, more for my benefit than anyone else's, because I could talk about this particular topic for a long, long time. So I'm going to press my timer. Let me just actually set it. And then as soon as you're ready, Julie, we can actually get cracking. Hang on, let me just make sure I have this on. Stopwatch, no timer, 15 minutes. Here we go. All right, I'm ready as soon as you are. So I'm going to press the button and then go ahead and ask your question.
Okay, so my question involves this really common topic of intercat conflict or intercat tension. So I'm kind of curious about how you approach these cases when the management piece can't be enacted. So, for example, if you have a couple cats with really high levels of conflict, for me, I would normally recommend strict separation with gradual introduction or reintroduction and desensitization and counter conditioning. But, commonly in some cases, management can be pursued. So just wondering if you have any tips on, keeping these cats under threshold and then still trying to move towards getting these cats together when you can't enact management.
Yeah, it's such a great question. And when I actually read through the question that you had sent through, which is exactly this question, my initial instinct was, I have absolutely no idea. Because it is such a tricky one, right? I think when we think about natural feline behavior, and that is what kind of governs all of this, the fact that cats are this non-obligate social species and they're not very good at reconciliation and reconciling their differences with each other. And if we have high levels of intercat tension or aggression in the home, not having the opportunity to separate can be really, really tricky. And I'm going to go as far as say that might contribute to a non-successful outcome if we can't get these cats below threshold because they're constantly faced with each other and they're constantly seeing each other. So it's a great question. So I actually went back to the 2024 Intercat Tension Guidelines, and I just wanted to see what sort of some of the recommendations or what even the definition was there. And I think that would be my kind of first piece, is that caregiver education. Because according to those intercat tension guidelines, whenever we have intercat tension, and that can be that kind of passive aggressive or more overt aggressive behavior, so anything from staring, stalking, blocking, chasing, swiping, whatever, and then physical fights, whenever we have that for over 50% of the time within a home, or if we have frequent tufts of fur, that's kind of one of the cardinal signs of an aggressive event having occurred. If we have either of those two scenarios, then those guidelines recommend separation. So that's kind of what we're dealing with. And so when we don't have that piece, it starts to get a bit tricky. And I think I would probably go as far as saying the first thing would be to be really clear in our information and education of the caregiver around this. If we can't separate, we might never get there, and we might be living with this low, medium, high grade aggression, tension for the rest of the cat's lives. And how does that impact their quality of life and their welfare? So I think that for me would be the first big piece. And then the other big piece, and this is something that I learned from Dr. DePorter, who was one of my 2 residency mentors, is to always look at what are all the behavior treatment plan approaches that we have. And I guess, the big 3, the big triad of environmental management, behavior modification, and behavior medications. Whenever we can't do one of those, i.e. management in this case, we have to potentially lean more on the other 2, which would be behavior modification. I'm going to put maybe things such as meeting feline behavioral needs and resources in there as well. But then we have to rely more heavily on medication. And that would be kind of my second education piece to the caregiver. If we can't manage the environment, or if you don't want to, or you can't consent to management of the environment, we're going to have to rely more heavily on meds. And sometimes saying that will maybe cause them to reconsider, actually, maybe then management is better than medicating one or all of the cats involved in that situation. So those would be, I guess, my first 2 big ones. The other thing is that sort of the third pillar, which is then the behavior modification piece. Well, if we have highly aroused and stressed cats all the time, they're not going to be able to learn. They're not going to be in a position to learn, go to a place, go away from each other, even desensitization to the presence of the other cat, because as soon as the other cat's present, the arousal levels are going to be so high and the stress levels are going to be so high that I think learning is going to be unlikely to happen.
Yeah, I think you brought up some really great points because I don't know. I think a lot of times it's, trying to think about, okay, well, if we aren't going to strictly separate, could we try to things like harness training or something like that? But you can't have a cat live in a harness 24/7 because that itself is inhibiting. So you don't necessarily know what the impact is on that cat. So I was curious. So you mentioned the medication component, which, I do think some people are sometimes hesitant to start things like medication. So if management isn't possible, would you then maybe jump straight to discussing antidepressants and just as used to try to bring down arousal and anxiety in those cases?
Yeah, exactly. And I think that is, if we think about what is our goal? How do we want the cats to be? What kind of an emotional state do we need them to be in order to make a reintroduction or a refamiliarization with each other more successful? And the biggest thing is we have to reduce arousal levels and stress levels. And that's where I think then, yes, we have to absolutely consider one or maybe more medications depending on the severity. And I think, I don't know how it is in the US, but I tend to see quite severe cases here where the levels of aggression are high. So kind of as soon as the cats see each other, it goes into, one cat really intensively sort of following the other and high physical fight. So once we have those levels of intensity and severity, impulsivity, arousal, then I think, yes, I would absolutely quite quickly go to a medication that would bring down arousal levels, such as fluoxetine. But then we also need to look at each individual cat within that whole scenario. So you might have situations where you have a classic relationship of aggressor versus victim cat, and you may or may not choose different classes of meds for those. You might have cats that are more than 2 cats that are in a very sort of complex social relationship with each other. So you might need to identify emotional states of all of those. And then sometimes you can even get these kind of changing, I guess, social dynamics where sometimes you have the one cat be the aggressor, sometimes the other cat's the aggressor. And, it can get quite complicated. So really weeding out the behavioral signs of each individual cat, and within the big picture, looking at each cat as an individual and seeing what they might need and what emotional state is involved. Is it frustration, or is it more likely to be fear and anxiety? And then depending on that, choosing medications that are going to target neurotransmitters that are specific for those emotional states. So that's how I would try and approach it. And it's always easier said than then when you're actually in front of the situation and you're looking at the cats going, what is going on with cats?
Yeah, it's so hard when, like the second they're in the same space as the other cat, they get triggered. So not being able to manage those triggers is something that I see pretty commonly. I'm sure you see all the time as well. So what about, I don't know how much time we have left, but what about management tips for, and for small spaces? Because I think in some cases we have you have scenarios where, the client does want to enact management, but just becomes a space issue, for lack of rooms to put, one of the cats, for example.
Yeah. So for that, I actually do have quite a good tip. And I actually just recently used it on a case of mine so we've got two main cats involved in the intercat aggression, and they were doing great. And then there was an environmental change and we had deterioration in the behavior again. And it transpired that one of the two cats could not use the litter tray in peace because the other cat was always following, always stalking. And so for that case, and for a couple of others that I've done before, we're actually using microchip guided cat flaps, so that traditionally the victim cat, but whichever cat we want to allow access to a certain safe space, only that cat can access that space. And that works super well. You still obviously need rooms to be able to provide that safe place. But I think once the cats understand, only I can get through this cat flap, and once I'm through this cat flap, I'm safe, then at least they have a way of self-separating almost. And I found that that's been quite useful in some cases where the caregivers just couldn't do the separation themselves because they felt they were being mean to one of the cats, or it wasn't fair, or they felt really guilty about, shutting one of the cats away, and they just couldn't bring themselves to do that. So then using that kind of, okay, well, we'll take the responsibility away from you, we'll give it back to the cats, and we're going to create spaces where only a certain cat or a couple of cats can enter into, and using those microchip guided cat flaps can be really, really successful. So I think that's one thing in terms of space. And then obviously the other thing is going up into the third dimension, right? If we don't have a lot of square footage, then using high spots, hidey spots. And hidey spots, again, can be a bit of a double-edged sword, right? Because you want to provide an opportunity for hiding, but you also then don't want that to become a trap for one of the cats when they're hiding, but then they're being stalked or, blocked whilst they're in that space. So I think with those, we always have to make sure we have an entrance and an exit, or it's some kind of a safe space. Or even if you have them up high and you have like a little box up high, make sure it's got, an entrance into it. That could be with like a walkway or whatever, into it, and then out of it from the back, so that the cats can always disperse away from each other. However, it's perhaps not a perfect solution if there is still opportunity for the cats to kind of get in front of each other.
Yeah, I think it's hard too because, often I'll see a senior cat, and they're the target of aggression. They may be having some mobility concerns, and they just simply can't get away from these 1-year-old cats, or, like these kittens that are like going after them.
Yeah. I wonder though, whether in that case, one of those microchip guided cat flaps, and making it super easy for the senior cat to, making it quite a low cat flap, maybe one that they don't have to kind of climb over too much, but having something like that where they learn over time, when I go through here, he can't get me or she can't get me, the young cat maybe can't get me. I think that from a psychological point of view, that providing safety, security, but also freedom and choice to go to a place where they feel safe, I think that can be really valuable.
Yeah, I do like that cat flap idea. So it sounds like, from your experience, that behavior modification isn't super successful if we can't enact some type of management.
Yeah, I mean, look, you could, but it depends on whether you can get arousal levels down enough that behavior modification becomes possible. And again, that's where meds might come in. And, I said earlier, I talked about fluoxetine and something that reduces arousal, but you could then pair that with something like a gabapentin, maybe even a benzodiazepine, depending on the cat. And then we sort of start to get into a polypharmacy situation just to be able to achieve behavior modification. And then that becomes an ethical conversation again, right? Like, are we, and it depends on which part of the world you're in a little bit. I know that my European colleagues have different views about this than perhaps my American colleagues, right? And I know Dr. DePorter would say, well, if that's the only thing that we can do for these cats, then we should be doing it. Whereas maybe some others, myself perhaps included, would say, but surely if we were able to get the management right, we wouldn't have to resort to. So it's one of those, you have to walk the tightrope a little bit and also understand where the caregivers are at in that whole scenario.
Yeah, too. And thinking about how long will these cats have to be on medication? Like if
Mhm.
you can't really bring their arousal levels down very much and they're just living with like a constant low level of conflict,
Yeah,
it's definitely the welfare issue that you mentioned is, yeah.
right. And look, conversations about rehoming, conversations about, so how would you like to get a bigger place? I have had those conversations with them. Yeah, are there any family members that really love one of these cats? Obviously in a more empathetic way. But some of those conversations will slide in there for me. It'll be like, so what do we think? Like, what is our long-term strategy for these guys? Like, what does this look like in a year from now, in 2 years from now? Just to give the caregivers a bit of perspective on the whole situation.
Yeah. I don't know if we have time for, are we about time?
40 seconds. We've got 40
40
seconds.
seconds. Okay. My last question, just a follow up here is, do you kind of start talking about time frame for trying to introduce or reintroduce at that very first visit typically? And, are you like, hey, we might be working on this for a couple of
Yes,
years or, okay.
I do, and I make it long. And
Okay.
exactly that. I'm like, look, we can do all the things. I can give you all the advice, but this might take a year, 2 years, and it may never ever be successful. I make
Yeah.
sure I always get that in there, and I do that right at the start so that we're not like halfway into it, kind of 3 months down. That was it. I just finished that sentence, that we're not like 3 months down the road and then the caregiver is like, wait, if you told us that it might never be successful, we would have never embarked on this journey. So just to make sure that I get that setting of expectations in there.
Yeah, that's definitely really important. Well, thank
Yeah.
you so much for those tips. I think especially a reminder about the cat flap and then having honest conversations with the caregivers, I think is really important.
Yeah, no, my absolute pleasure. But just before we do kind of wrap things up, tell me a little bit about some of the cases that you see in the US, because it absolutely fascinates me, because I think, the population that I see here in the UAE is so unique. And I'd be really interested to hear, especially for you as a feline mainly home visit practitioner, what kind of cases do you generally see when it comes to this inter-cat tension in terms of severity and how many cats are typically involved and that sort of thing?
I would say, as far as intercat tension, it sort of runs the gamut. Many times that's not even the primary concern. And then I'm, there for some elimination issue. And then you watch, this is why house
Yeah.
calls, I think, it's obviously not everyone can do them, but it's so helpful when you actually see. I mean, I've seen conflicts so many times, just me being there at the home. And if I'm there and it's like, I'm there for 2 hours and it's like, wow, how many times a day is this happening when I just happen to see it for this 2 hours? Um, as far as severity, I mean, I just had a case a couple of days ago where, they described fur flying. So I think probably similar to you. But, this cat didn't have any growling or hissing. So I guess for me, commonly it might be a younger, like a kitten or a younger cat that's introduced. So the case I had a couple days ago, it was like a 2-year-old cat with two littermate kittens and they were having conflict. But yeah, I would say severity wise, it really runs the gamut. I tend to see two cats, having conflict, but also 3 cats, or
Right.
I'm there for 3 cats and it's like a multi-cat home beyond that. And there's, you know what I mean? And so there's just so many factors when when you start delving into these cases and then thinking about, oh, what medical contributors could there be? And all these little relationships. And yeah, I think in some cases it can definitely be hard, because if you're not even addressing some of these other kind of side relationships that aren't even part of your case, like you're
Right.
thinking, wow, is this having a 10% effect on this conflict, and maybe, causing issues with that. So yeah, I think the house call, model is really great. So if anyone's thinking about, going into this field and helping with feline behavior, because just you get to go there and see the litter boxes and see just how resources are set up and grouped together sometimes, like,
Yeah.
3 litter boxes in a row, and just, and also just seeing the medical stuff too. So I like to peek in the litter boxes and just see what I'm seeing. And it's like, oh, you see this huge urine clump that's not covered. So why isn't it covered? So just kind of delving into things like that. So, but yeah, I would say for my cases, intracat conflict tends to be the most common presenting complaint, followed
Same.
probably by elimination issues. And then I would say pretty much all my patients have a fear of the vet that I also address as sort of a side thing. But, a lot of these cats, they aren't able to get to the vet, or, just from a fear of the vet, fear of the cat carrier travel.
Right.
So trying to work on that, part of it simultaneously.
Oh, that's brilliant. I love it. And I think you're absolutely right. So I do all of my UAE-based feline cases also as home visits. So I go there because, exactly like you say, there's nothing like seeing it. And I still sometimes go into some cases and I think, oh, I've never seen that one before, and sometimes, exactly like you say, the way resources are set up, or the way, things are positioned, and you just think, crikey, if I were a cat, I wouldn't even be able to get in that litter box, let alone and be able to eliminate in it. So I love that. And I'm really also very surprised that you also say that intercat tension is your main presenting case, because I've traditionally heard from my colleagues, most of my veterinary behavior friends, that their number one cases are usually elimination issues. So cats peeing outside the litter box, urine marking, voiding, whatever it might be. And then after that would come intercat aggression, then comes human directed aggression, and then come a whole host of other issues. So yeah, and I think it's so great that you offer the home visit, or I think a house call in the US, you guys call it, service, because a lot of cats where that service isn't available, they don't get to see the vet for years sometimes, because they can't get to the vet, or it's perceived by the owners to be such a stressful experience to get them to the vet, that they don't get the benefit of that routine veterinary care. So I think you're doing such a great service for the cats of Austin, Texas. Yeah.
Thank you so much. Yeah, I personally wish I could see more elimination cases, because
Yeah.
for me, I feel like a lot of times those are much more
Oh, yeah.
straightforward. And I think prognosis is a lot better, versus if you have
Agreed.
cats that are just incompatible, like what
Yeah.
can you do? I mean, you can try to work with
Yeah.
them, obviously, but I do
Completely
think
agree.
sometimes, caregiver wise, it can be much more frustrating and long term.
Yeah, I totally agree. I'm always happy when I read on my questionnaire it's an elimination case, because I can do something about this one, like you
Yeah,
say.
especially if it's medical. It's like, oh, UTI, yes,
Yeah,
or arthritis, where you manage that, and then you find a great litter box for the senior cat or whatever.
Yeah,
But yeah.
I agree. And my heart always sinks a little bit when I see it's yet another intercat aggression. Oh no. But that's funny. Sometimes I've gone in and I've made a suggestion of, so what do we think? Like, have we got any plan Bs if this doesn't work out? And then the caregiver has been like, oh yeah, my, I don't know, mum's sister in whatever country, not in the UAE, would be really happy to take this cat if it doesn't work out. And that makes my heart a little bit lighter then, because I think, okay, great, we have a plan B. We have another option of improving the welfare for these cats if we can't make a quick win, in terms of trying to resolve some of the relationship issues.
Yeah, I think being upfront with that and bringing that in quickly, I like that suggestion too.
Yeah. Yeah.
Yeah.
And sometimes you get surprised, because the clients are like, oh yeah, we can absolutely. My brother's already said, like, if they keep fighting, I'll take him, and then you're like, okay, why don't we do that? So sometimes that's an easier solution than going through the whole trying to reintroduce the cats to each other and,
Yeah.
and reduce their arousal and help them feel better.
Yeah. I always think about is like if you just had some random person move in with you and
Yeah.
then they're gonna live with you for the rest of your life,
Yeah.
then it's like, oh, you can try to make it work, but not in every case, So yeah.
Amazing. Well, thank you so much for bringing that question, and also for chatting to me a little bit about your caseload. I'm so fascinated about the types of cases people see in other areas of the world, especially the feline cases, because I feel that I see so many of them, and I don't think necessarily everyone gets to see as many cats as I do. So I love being able to chat to somebody who sees as many cats as I do. So that's great. So yeah, thank you so much. I hope it's been useful.
Yeah, thank you so much. These are great tips. I really appreciate it.
That's great. So to everyone listening, thank you so much for tuning in. If you would like to be on a 15-minute speed coaching episode, I'm going to put the link to apply in the show notes. I'm also going to put the link for my Learn to Speak Cat course in the show notes, because a lot of what we've spoken about today is kind of reiterated in the course. And I'm also going to put the link to my psychoactive course in case you're interested in what kind of psychopharmacology agents might be useful for these cases. So there are 3 great resources for you if you either want to come on and chat to me, or if you would like to learn a little bit more about feline behavior and how you can help your feline patients. So thank you once again to Dr. Julie, and thank you everyone for tuning in, and I will see you next week for episode 128. Bye for now.
Bye.